From the Toronto Star, I'm Adrian Cheung, and this matters. Right now, there are more than 100 teams of scientists and pharmacists around the world that are trying to create a vaccine against COVID-19. But when and if it becomes widely available, will we use it? Anti-vaccination activists are seizing this moment, trying to cast doubt on the safety of vaccines. Many are joining armed militias and anti-government groups at reopening protests in the US and in Canada.
Open California! Open California! Open California!
They're campaigning under a similar banner of freedom, individual liberty, and for anti-vaxxers, personal choice. Celebrities like Jenny McCarthy have taken those views mainstream.
Without a doubt in my mind, I believe vaccinations triggered Evan's autism. So I think they need to wake up and stop hurting our kids.
That's actually a pretty common thread among anti-vaxxers. They usually cite a long-debunked and discredited study that linked the measles, mumps, and rubella vaccine to autism. There's no scientific truth to it. But still, vaccination rates in Canada have been dropping. Measles outbreaks are happening. The World Health Organization calls vaccine hesitancy one of the biggest threats to our global health. And now, anti-vaxxers are turning their focus on a COVID-19 vaccine. Their main point? If a vaccine is created, they don't want it. But those ideas aren't really compatible with how the world is depending on medicine and science for an answer to the coronavirus. Doctors and nurses are saving lives. Scientists are working to find a cure. Epidemiologists and public health officials say that a complete return to what our lives were like before the pandemic is dependent on us building herd immunity to the coronavirus. And most likely, that's through a vaccine. Will COVID-19 actually kill off the anti-vax movement? And when a coronavirus vaccine finally does exist, should it be mandatory to get it? Today, we're talking to Dr. Noni MacDonald at Dalhousie University in Halifax. Her career in public health and global medicine has spanned nearly 40 years, which includes serving as a consultant to the World Health Organization on immunizations. Dr. MacDonald, you've spent more than 20 years researching and advising on immunizations. How fundamental are vaccinations to public health in Canada and global health as a whole?
So let me put it in context for you from a Canadian perspective. We increased our survival rate by about 30 years in the past century between 1900 and 1999. 25 of those 30 years were due to only three things: immunization and clean water and sanitation were the biggest contribution, and then antibiotics was the third. The last 5 years of increase is all the other stuff we did in healthcare. Like, this is fundamental, immunization are, for the health and well-being of everybody on the planet. It's not small potatoes, it's big. And the problem for us is because most of us no longer see vaccine preventable diseases, we just don't think it's a problem. The reason we don't see them are because we're immunizing against them. It's not because they're gone. So again, let me give you a context. If you went to any graveyard here in Canada for the 1910s and the 1920s, you would often see a whole number of family of kids that had all died. And they all died of diphtheria because we didn't have a vaccine. Once the vaccine came in, it was one of the leading causes of death of children at that period. It isn't anymore because we're all immunized. Now you can say, well, we don't need to bother because diphtheria is gone. Well, we had some diphtheria outbreaks globally last year because there were pockets of people not immunized. I mean, it came back. And then, hey, measles keeps on coming back because you need to have enough people immunized against measles to provide protection for the other people in the community who can't be immunized. And then let me give you the last piece that kind of fills out this whole importance thing. A lot of people say, well, I'll let everybody else get immunized and that'll protect me. Well, tetanus, it doesn't matter if every other one of the 7 point whatever it is billion people in the world were immunized against tetanus. There's no protection for you because you have to individually be protected. There is no herd or community immunity for tetanus. It's one by one by one. And you say, oh, well, I don't have to worry about that. Tetanus is no big deal. Even today, with the kind of healthcare we can give in high-income countries like Canada or the US or Germany, the mortality rate is still 10%. Even if you had tetanus, you're not protected against getting it again. You have to be immunized. It's the only way to be protected. And you need 3 doses to be fully immunized. So it's a big deal to get immunized. It's a small thing with big protection.
Your point there actually leads me to my next question, where I want to quickly define this term that many people listening may have heard of, which is herd immunity. Can you explain what that term means and how it's tied to how vaccines work?
So for some infectious diseases that we can transmit person to person, if I decrease the number of people that could potentially be infected, I can decrease the infection rate. So what did we do during this COVID-19 thing? We locked down. We kept you home so that you could not be in contact with other people that were potentially infected. The other way round for that is to immunize all of those people that you're going to come in contact with so you don't get that infection from them. The problem we have is that different diseases require different amounts of people in the community to be immunized to provide the protection. For some of them, 80% will do. For ones like measles, you need to be over 95% of the people immunized to be able to be protected because it is so infectious. Now, COVID-19, we don't have a vaccine yet. Lots of people working on it, but not there. It's moderately infectious. It's not as infectious as measles, but it looks to be more infectious than the flu. And the flu is not trivial in its infection rate. I'm going to guess with COVID-19, we might need high 80s, low 90s of people immunized before we'll see community protection from it.
That whenever there is a vaccine available, a pretty big majority of us will need to have this vaccine.
And that's the reason I sort of lift my eyebrows when people say, oh, well, we'll need to make it mandatory when it comes. Adrian, we're only going to have maybe, I don't know, if we're very lucky when the first couple of companies get their vaccine out there, we might have 10 million doses. The population is over 7 billion. That's like spitting in the ocean. You can't make something mandatory that you can't get access to. Okay. So the more important question is, are we going to have vaccine early in Canada or not? And who should we be giving it to decide who's going to get our little meager supply? Who's going to have access to it?
Especially in more developed countries like Canada, high-income countries, do you think we take the science behind vaccines for granted?
Yeah, I do. And it's really complex. And I'm not trying to denigrate anybody, but there's so much misinformation and disinformation out there. And people are getting bombarded by it all the time, every day. Okay. Drives me crazy. But we haven't taught a lot of people how to recognize when they're being conned with disinformation. And we haven't taught people how to check if the information they're getting is correct or if it's misinformation. And we know from studies that you can teach people how to recognize disinformation. And I'm going to use some terms here, and I want you to think about, we have some people out there who do this kind of stuff all the time. They invoke conspiracy. They misrepresent and they use false logic. Okay, so you go like, that doesn't follow from what they've said. They're very selective about the science they put forward. They lift it out of context. They use fake experts, people who have no credibility in the scientific community for that particular piece of information they're putting out.
Celebrities sometimes.
Celebrities. And gee whiz, I think we had a president to the south of us who put forward that you should inject disinfectants.
And then I see the disinfectant where it knocks it out in 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs.
I mean, I'm going like, whoa, where did that come from? And then they want a vaccine to be 100% safe and effective. Getting out of bed is not 100% safe and effective. There's nothing that's 100% safe. So those unrealistic expectations, and when you understand that that's what disinformation groups are doing, and you start listening, you go, oh, wait a minute. What about that? What about this? Is that really an expert? No, not somebody I should be paying attention to. We need to be teaching our kids about those techniques and helping them to be protected about disinformation as they're growing up. And there's actual evidence, science, to show that teaching people this and how to recognize it actually helps protect them against disinformation.
information is spreading at a more rapid clip than ever. Is that also true for disinformation?
Yes, yes. And until very recently, disinformation, because they're trying to sell you something or they're trying to sell you an idea or another product, or it's about their prestige and their power, there always is usually a secondary gain from people that are really spreading the disinformation. We know that much more of it's out there than used to be. And until very recently, many of the social media platforms are now recognizing that and trying to not forward those on, not have likes, to try to decrease your risk of coming in contact with them. There's no way they can get them all. And that's why you need the protection. But the other piece is, this is really one of those terrifying statistics and has been shown again in other studies, but 5 to 10 minutes on an anti-vaccine website changes people's beliefs and decisions about accepting vaccines. You can get conned if you don't start to recognize what you're seeing and what they're trying to do to you.
That it plants a seed of doubt.
That's right. Right. That's right.
You've studied immunization and vaccinations for decades now. Have you seen the anti-vax movement or vaccine hesitancy? Has that become more widespread over the last, 10, 15 years?
If we go back centuries to when smallpox vaccine first came out, there were anti-vaxxers at that time.
Really?
Yes. So it's the whole idea of concern about vaccination isn't new. What is new is the amount of disinformation that's out there, the routes that they can spread it on now. That has really changed since the internet came into being. And the real problem on the internet is that anybody can stand up and say, I'm an expert, and start sprouting forth with their things. Now the turnover of information is so quick, journalists don't have a lot of time to go back and check their information. It's just not possible. So for all of those confounding reasons, it's really snowballed. So that's why the World Health Organization stated in 2019 that vaccine hesitancy was one of the 10 global health problems. It's global. There are almost no countries in the world that don't have hesitancy. One of the things for me that I always get concerned when people talk about the term hesitancy is that when we think of somebody who's hesitant, they're kind of standing back, trying to make a decision and so on and so forth. It's not quite what it is. You have people who have made a decision. They're very decisive, not hesitant, that they don't want that vaccine on schedule or they don't want that particular vaccine, but they'll take the others. So it's a whole continuum of people, some who will take vaccines but still have concerns, right to the other far end of the scale, which in Canada is probably less than 2%, who refuse all vaccines. That's a very, very small group, but they can be noisy.
And I think that's an important point, that the vast majority of Canadians are vaccinated and continue to trust vaccines, right?
That's right. It's normative behavior. We just don't talk about it enough to say it's normative. And I would say back to you, Adrian, I have no idea if you got your flu vaccine last year.
I did.
All right. So you did. Did the person who gave you the flu vaccine said, gee, Adrian, that was really good that you did it. It's good for your health and it's good for helping others around you. Did they say that? Because we as healthcare workers often don't reinforce in those who get vaccine how important it is that they did this. We just do it to you and say, thanks, bye. It's very important that healthcare providers reinforce the really positive behavior that you did by getting your vaccine. And you need to share that with others. Hey, I got vaccinated, because all of us are influencers within our own little group that we work with, that we live in. And I got my vaccine last year. You got yours. If we talk to our fellow people that we interact with, it helps them see that it's normative behavior.
So for that group, though, that continues to be very, very vocal, right? Even now with COVID-19, there are many people who say that they don't trust vaccines, despite that there's a huge body of evidence and research that shows that vaccines are safe. So changing minds clearly can still be very tough. How do you convince people otherwise? How do you build widespread trust in vaccines?
Well, there's a couple of things I want to say there. Some of it you have to do at the program level, and some of it you have to do at the individual patient level. But I'm assuming that most people are going to be listening to this are at the patient level as opposed to the program level. So let's talk about some of those at the patient level. Well, first of all, we know that most people trust their healthcare worker. And so if you've got concerns about immunization, you should be talking to your healthcare worker. And that can certainly be done by telehealth now. It doesn't have to be done in person. And you need to share your concerns and then listen to what they may be telling you, ask again, and then listen again and have that conversation go on so that you get your concerns answered. They can steer you to some of the resources out there that are really helpful, where we've got good scientifically evidence-based information. And you should be checking with those known trusted sources instead of going on the internet to just Google and see what's out there.
That it's a real conversation with your doctor.
That's right. It's a real conversation with your doctor or your public health nurse. And you really have a chance to discuss and see what the problems are. And then I think it behooves all of us as good consumers to go to the websites that have good information on them, like the Public Health Agency of Canada, all of the provinces, including yours, Ontario, has good information up for people on their public health websites that you can go and check stuff out. And if you see stuff that you're curious about and say, wait a minute, what about that? Then you can go and talk to your healthcare worker about it.
For somebody who works in immunization like yourself, is it frustrating to know all the work that you've done and still see so much misinformation spread?
I want to say that as a yes and a no. We're all people. We get bombarded by information on all different kinds of areas every day. Pick your topic, from climate change to should I be supporting pipelines to what should I be doing about what foods I'm eating, blah, blah, blah. And none of us can be an expert, a really scientific expert in any of those things. And so I think what I've learned over time is you don't blame the general public for not getting this right. You try to provide resources for them, both in terms of tools that they can go and use, as well as healthcare workers well educated to be able to answer their questions. And that's where I think the real thinking has changed. In the olden days, we used to just say, let me correct that myth. Let me correct your fact. And what we now know is, in some ways, that reinforced the negative fact. And that was not a good thing, as we've learned more about the psychology underlying this. And now we have much better tools, much better information, much better strategies for trying to help people. But it's not going to ever go away. I think it's incredibly important to educate kids about how they can be conned by disinformation and misinformation. And we know when you help shape kids' beliefs, when they grow up, it helps them make good decisions as adults, and they're going to have more skills to not be conned by these people that are trying to sell them something.
I wanted to center back to COVID-19 as well, right? Because knowing that any real return to a normal life without all the physical distancing measures we have now is really dependent on a vaccine, on mass vaccination, on mass and herd immunity. There's so much reported about vaccine development going on. Do you think that a byproduct of COVID-19 is it actually sowing seeds of doubt into the anti-vaccination community?
I think you can look at that. You can be the optimist or the pessimist on this, okay? Some people would argue as the optimist that COVID-19, the only way you can protect yourself is to be immunized. And so there will likely be high demand for the vaccine when it comes, and there'll be low supply.
So it won't even be available to everybody?
It won't initially. There's no way. We won't have enough. We'll have some, but we won't have enough. I mean, we've got over 7 billion people in the world. That's a lot of vaccine. And there's a lot more work that needs to be done. I mean, there's a lot being done on vaccine development. We've got to have a vaccine that's safe and it's effective. And you'll only get those vaccines available when they have been proven to be safe and effective. We can't do this in like a month. This takes quite a bit of time. I think as there's conversation about vaccine and people learning about what went into developing those vaccines, what went into testing them, that some of this will help people understand somebody doesn't make this in their garage and then sells it, okay? There's a lot of safety steps that are put in there to make sure it is safe and effective. Vaccines are safer than our drugs. They're
Really?
held to a higher standard.
More trials,
higher safety stuff, because we give them to healthy people. We give drugs to people that are sick. So we hold them to a very high level. And Canada has a very good vaccine safety system.
The development of a coronavirus vaccine is really happening at a record pace, but the timeline is still at least 12 to 18 months away, at least, right? So if and when a coronavirus vaccine is created and is widely available, this conversation has already started.
As to what sort of vaccination protocols will be in place, we still have a fair bit of time to reflect on that in order to get it right.
Should it be mandatory for all Canadians to get it?
Mandatory is a very complex thing, Adrian, and you have to think about what you mean by that. Do I think eventually it should be offered to everybody? Absolutely. Should we make access to it easy? Yes. As easy as we can make it so we can encourage as many people as possible to be immunized. Mandatory implies that there is either a penalty if you didn't get it, Adrian, or there's an incentive for you to get it. You can either have one or the other, okay? And somebody's checking to see who's received it and who's not. And therefore, that's a complex system to put into place. And you have to decide if that's where you want to put all of your resources. So, for example, I, as a healthcare worker, cannot work inside of a hospital here in Canada without having my hepatitis B immunization. That's really important because if I was hepatitis B positive, it's so easy for me to infect you. And that's bad. And I also need to protect myself in case you're hepatitis B positive so I don't get infected from you and then inadvertently transmit it to somebody else. So there are some clinical situations where it really is mandatory to do this because the risk is too high to spread from one to the other. So, for example, we might make it, I'm putting this in quotation marks, easy access and mandatory for healthcare workers to have COVID-19 vaccine. Now, given that we've seen healthcare workers die because they didn't have proper protection, I think most healthcare workers would be quite pleased to be able to get access to it. Are we going to make it that everybody, I don't know, your telephone lineman out there preparing the electrical things on the telephone poles, are we going to make all of them have to have COVID-19 vaccine? I think we've got to think about this before we say everybody has to have it. I think we need to really work on making it easily available, access, helping people understand why they should have it, what the benefits are, what the risks are of not having it, and then trying to encourage as many people as we can to get it.
And possibly in specific contexts, like you mentioned, you might have to provide an immunization record, which is already happening for certain vaccines.
So I think it'll depend a lot on what we learn about COVID-19. What is protective? Is everybody who's going to get the vaccine, is there a high rate of protection with it? Or is there only a 50% rate of protection? It'll depend on how good our vaccine is, what we're going to have to do with that in terms of high-risk situations like healthcare workers.
Dr. MacDonald, thank you so much. Really appreciate your expertise.
You're welcome.
That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.